On top of Hawthorne Hill was one of the best known insane asylums in the country, the Danvers State Hospital. In 1878, the doors to the asylum first opened, with goals of treating mental patients and curing them forever. Little did the patients know, from the time they took their first step through the door until the time they left, their lives would no longer be the same. Their lives would be hell. During this time period, people believed that if you had any mental disorder or anything that made you different from society, that you should be locked up. Dr. Thomas Story Kirkbride believed this was the right thing to do. Kirkbride, however, did not open the hospital, but his innovative writings on hospital design became known as the Kirkbride Plan, which influenced the architecture on many of the asylums across the country. Kirkbride taught to others that beautiful settings restore patients to a more natural balance of senses. On the property of the hospital sat one main building. This building was called the Kirkbride Building, which cared for the patients by housing them, feeding them, and giving them certain treatments here. There was also smaller buildings and houses on the grounds. These were only connected by tunnels. The single houses usually cared for one specific illness. This building here was the living space for female nurses. Most of the nurses were permanent residents at the asylum. This building was the male nurses' housing, where they too were permanent residents. However, the patients did not have nice rooms to stay. They were trapped. This is a picture of a patient's room. It was taken after the hospital closed in 1992. Once the patients entered the asylum, they were not in the right state of mind anymore. They felt helpless and alone. They were trapped. When the patients passed away, they would store the bodies here until they were ready to be buried. Ice baths were believed to give the patient relief. They would be strapped into freezing cold baths until they were unconscious. This was one of the baths in the hospital. This is a steam cabinet where patients would sit to relax their muscles and minds. This was one of the few treatments that actually worked. The wooden crib was a very harsh place to trap a patient when they could not be controlled. Patients would be locked in until they calmed down, but this usually only made it worse. One of the most popular treatments was called lobotomy. With this treatment, they would inflict 2 quick shocks to the head, roll back one of the eyelids, and insert a device that was about the size of a pencil through the eyelid and into the patient's head. After that, they would tap the device with a hammer in the frontal lobe of the head, and then pull the device out. This treatment usually resulted in death or mental retardation. The interior of the hospital was very open. Although most of the patients' rooms were small, the halls were wide open with big archways. This was part of its architecture. The farmhouse is where they prepared the food grown. As a therapy, they would have the patients go outside to plant and farm their own vegetables. The graveyard was very big. The gravestones were only marked with numbers, not names. This was the Our Lady of the Hill Chapel, one of the 2 churches on the hospital grounds. Tunnels were used to travel by foot from one building to the next. Patients usually were transported through them. Danvers State was known for its architecture. However, in 1992, due to budget cuts within the mental health system, the asylum was shut down. Later, in 2006, Danvers State was knocked down to build apartments. It took many years of fighting for this to occur. Although Danvers State Insane Asylum is no longer standing, it will never be forgotten. Were all those treatments fair? Did they work? No. So why did we treat these people so harshly? That is one question that will never be answered.